Okay, so this is my audience. Okay. Hello, my name is Emily Fisher. Did you know that there are 2.9 million RNs, registered nurses, in the United States? I am currently a sophomore studying nursing at Liberty University, which I am thoroughly enjoying, even though it's a challenging field of study. The purpose of my speech is to inform you about the job field of the registered nurse and how it can be used as a platform for promoting compassion. I'm going to explain the different aspects of an RN's job. I will validate the thesis by discussing these 3 points. Nursing can be used as the hands and feet of Christ. 2. The 3 ways for a person to become a registered nurse. And 3. The fact that nurses must pass a national license examination to demonstrate that they are qualified to practice nursing. And then they can choose which career option that they would like to pursue. So, nursing is a way to be the hands and feet of Christ. Being a nurse is an excellent way to show compassion for others, which is something that God highly values. For example, Jesus healed many people through his miracles, and nurses help heal people through their skills and knowledge. But ultimately, God is the one who is the great healer. In Matthew 4:23-24, it talks about how Jesus healed multitudes of people. The top 5 words that describe a good nurse are caring, compassion, knowledge, dedication, and professionalism. All of these are things that God values and wants us to use to glorify him through our lives. Galatians 6:9-10 tells us not to grow weary in doing good. Whenever we have an opportunity, let us do good to all people. Nurses have the opportunity every day to do good to people by taking care of their illnesses and meeting their needs. So there are 3 ways for a person to become a registered nurse. 1 is by getting a bachelor's degree. It takes about 4 years to complete, and accelerated BSN programs last 12 to 18 months and provide the fastest route to a BSN program for individuals who already hold a degree. Another way is by getting an associate's degree. It takes 2 to 4 years to finish. Often people who have already obtained an associate's degree in nursing will get an entry-level position and then take advantages of tuition reimbursement benefits to work toward a BSN. This is called an RN to BSN program. The final way to become a registered nurse is by getting a diploma. Schooling lasts about 1 to 2 years. It does not have as many advancement prospects as people who hold BSNs. After all of the extensive schooling, nurses must pass a national license examination to demonstrate that they are qualified to practice nursing, and then they can choose which career option that they would like to pursue. Some of the career options are hospital nursing, and it's the largest group of nurses. Examples of hospital nursing are intensive care, labor and delivery, psychiatric, and hospice nursing. Another option is ambulatory care nursing. It takes place in clinics or environments where patients come to be evaluated and treated. Examples would be outpatient departments, nurse-managed centers, and physician or nurse practitioner group practices or clinics. Community and public health nursing focuses on populations, individuals, and families to improve the overall health of communities. Examples would be schools, disaster areas, the military, and home health or home care. To conclude, you should now be able to understand the ways that RNs can be used as the hands and feet of Christ, the schooling RNs have to complete, and the different career possibilities for RNs. Nurses have to go through a lot of intense schooling, but they are what keep hospitals running smoothly. To close, I would like to share a quote from Florence Nightingale, who said, "Nursing is an art, and if it is to be made an art, it requires an exclusive devotion, as hard a preparation as any painter's or sculptor's work. For what is the having to do with dead canvas or dead marble compared with having to do with the living body, the temple of God's Spirit? It is one of the fine arts. I had almost said the finest of fine arts."